I'm Beth Friedman,
I'm Joe Foster.
and this
is Finn Voices.
This is Beth Friedman. I'm senior partner at Finn Partners, and I'm based in Atlanta, Georgia. Welcome to Finn Voices, where we talk about healthcare IT, healthcare innovation, and everything in between. On today's episode, I'm joined by Todd Doze, Chief Executive Officer at Janus Health. Janus is a revenue cycle tech company, and they're dedicated to helping health systems get paid and to lighten what we know in healthcare, those huge administrative burdens. Todd was recently appointed as CEO, and we actually had a chance to sit down over coffee at the recent HFMA conference in Las Vegas. But he's no stranger to healthcare. He's a seasoned leader with 20 years experience specifically in our topic today, revenue cycle. We're going to talk about the rapid advancement of AI and other technology in the rev cycle. We're going to specifically focus on Janus's experience in working with health systems and what Todd is seeing on the adoption of AI in rev cycle, the good, the bad, and the gotchas of AI in healthcare rev cycle and in that implementation. So Todd, welcome to Finn Voices.
Thank you, Beth. It's great to be here. Thank you for having me on your show.
Absolutely. Let's start by telling our listeners a little bit about your journey in healthcare and, obviously your experience in the rev cycle.
Yeah, pleased to do that. So as you mentioned, I've been in healthcare rev cycle for 20 plus years, I guess coming up on 25 here next year. But no stranger to technology. So I started off 25 years ago, really when the HIPAA EDI standards came out, which was a prescription on how payers and providers were to exchange data. And at the time, I was doing large eligibility matches, burning data to an encrypted CD and mailing them off to different payers and getting a file back 3 weeks later if I was lucky. And what the HIPAA EDI exchanges did was provide a platform and a data standard in which to expedite the sharing of data. But also what it was a complex standard to adhere to. And I knew that, this standard would be very difficult for both payers and providers to, make changes in order to actually comply with the standards. And so at the time I went to the company that we were, doing these matches with and offered a way to monetize this exchange platform, and they didn't understand what I was talking about and certainly didn't want to invest in something that they didn't know about. And so for me, there was a vision to start a company to do this. And so we were literally three guys in a garage. We started Trinity Healthcare Resources and created a web bulletin resource in order to facilitate Medicaid and large other commercial insurance eligibility transactions. And we private labeled it to some of the largest systems in the country. I think at the time I sold my interest, we had over 1,000 hospitals subscribing to our technology way back in the early 2000s.
That's so impressive. So literally from idea, concept, business problem, idea, concept, development to 1,000 customers. That's pretty amazing.
Yeah. I just wish we would have priced it a little bit better.
We would both be retired, right?
Right.
Well, thanks for that description of your career and your experience. So, based on that, let's fast forward to today. You're CEO of Janus Health, an AI and revenue cycle technology company. So still back on that bleeding edge of technology and applying it to solve problems in healthcare. You mentioned that your company before was connecting payers, providers, trying to make those transactions simpler. Gosh, there's still a lot of pain and abrasion in that transaction. So let's talk about that real briefly. What do you see as those biggest mismatches that still occur between payers and providers?
Yeah, it can be really mind-numbing as to, why we haven't made more progress to facilitate the exchange between data between providers and payers. But, it's still a cat and mouse or a shell game, if you will, for providers to try to extract the right information and the right way in which to submit their claim data in order to get paid correctly. we understand why there's not an incentive for payers to make it easy for providers to submit claims, but it just creates so much inefficiency in the market. And it's extremely frustrating for providers who face such thin operating margins. And then also it's very frustrating for patients who, have to wait for providers to, get their claims corrected, or they get the routine rejection of claims by payers. And so it's really sort of a unique dynamic within our economy, and one that I can't think of exists in any other, vertical within our, global economy. And then you pile on top of that the ever-changing regulatory requirements for providers in order to get paid correctly. And it just creates an environment that, is just extremely ripe for inefficiency. And so, my mission really throughout my career is to try to stay, on the cutting edge of technology, and to try to help providers utilize technology in order to make their jobs easier, and really allowing them to focus on what they do best, and that's provide care to their patients.
Absolutely. So freeing up some of those paperwork, even burdens, I'll call them operational burdens, so that we can take better care of our patients. But the one point you made is really important, and we can get paid for it.
Right.
And paid for it correctly. So that's where companies like Janus Health comes in. Certainly a lot of other revenue cycle technologies, but I was just really interested in yours when you and I met at the HFMA conference. You shared with me some of the kind of horror stories. Your technology is AI, machine learning, RPM, all the latest and greatest. But what you've told me is you guys have seen out in the market some health systems and hospitals implementing these tools, but you've kind of seen some sort of cautionary tales, or you've seen some unintended consequences happen. Can you share some of those with us?
Yeah, and even at Janus, we're certainly no stranger to, pitfalls or, unexpected, twists and turns, particularly leveraging AI models. It's such the technology is such in its early stages of use cases, and figuring out the accuracy of the model and how fast you can go and how much human interaction you need to have, to really be able to derive accurate results using the models. We don't know yet. And there are different models out there that produce different results and focus on different areas of, data sets. And so I would say for, hospitals trying to leverage AI, and everyone that I've talked to, particularly at the large systems, either have somebody assigned as a chief innovation officer, or they've, tasked their CTO with, earmarking, large amounts of their budget towards leveraging AI to make their business more, efficient and efficient and automated. You have to have a team of engineers, to be able to develop software, and providers are in the business of delivering care to patients, not developing and maintaining, software. And so, you have to have engineers that have specific experience, with software languages that interact with AI models. And so on top of that, you have to have, very, distinct environments in which to be successful in, developing and maintaining software. You have to have a testing environment. You have to have a QA environment. You have to have a production environment. And then, it's tough to, really prioritize. There's so many different use cases out there where AI could be applied, calculating what the potential ROI with these use cases and prioritizing how you deploy resources to go leverage AI can also be tricky at this point too, because there's not a lot of, empirical evidence out there to say that, the use cases for, referrals or, prior auths are the way that, you should go with, your initial round of investment in AI. We've also heard stories of, hospital systems trying to go it alone using some, off-the-shelf applications to be able to develop some of the platforms to leverage AI. And, I've heard cases where, those entire, 12 to 18 month investments, millions of dollars have, just been, gone down the toilet essentially, which is, really unfortunate, and I'm sure frustrating for those facilities as well. And so we're here to help. We have, I think, a unique company in that, we have experience leveraging AI, but we also have very deep healthcare rev cycle knowledge across our team.
Yeah, that was something that impressed me when I met you and got to learn more about the company was, there's, I don't know, I feel like, especially at that conference, companies saying that they're an AI technology were a dime a dozen, but you guys have that deep bench of revenue cycle knowledge. I mean, your career alone speaks volumes, not to mention everybody on the team. So you mentioned development engineers, some of the requirements around that. I assume, so let's say we get a use case, good use case, it's going to solve the business problem and it works, right? We've got a good team to support it. What's the long tail look like? What's that long-term maintenance, feeding, support of an AI system? Kind of describe that for us.
Yeah, it's not just building the system and then, hey, you've got the magic, turnkey solution. There's really a lot of maintenance that goes into it. So, having a long-term vision and having a long-term investment strategy, whether it's something that a provider does alone or whether they partner with a company like Janus, the things to be aware of it really is AI models change, and new models come out that might offer more accuracy or faster results. And so there are dozens of AI models out there today. Security requirements change, and we're just really scratching the surface on what are the security requirements for AI models and what are the IP concerns as it relates to AI models. These are all things that it's a little bit like the Wild West, quite frankly. You have to manage the how you interact with the payer portals. Those change all the time. URLs change, forms change. They change buttons on their page, and all of that requires maintenance in order to make sure that your models work and that the automation that you initially set up is continuing to deliver value. And so I think, those are things that people don't always think about or have experience with. And you really have to be aware of those things as you think about a long-term AI strategy.
I mean, if we just liken it to, I know the technology is totally different, but if we liken it to, any kind of hospital system, IT maintenance over time, or the EHR maintenance and optimization, this is going to need continued work, continued support, continued care and feeding.
Yeah. Yeah. And it's more complicated because it's new. And not only is it just new technology, but I mentioned earlier the IP concerns, the security concerns, all of these things are brand new to us all. And so there will be mistakes that are made along the way. There will be costly mistakes along the way. And so I think, the more that the community can work together and share.
Janus Health is a revenue cycle management technology company aiming to change the way healthcare systems function through AI and automation. We boost revenue cycle efficiency and effectiveness through advanced process intelligence. Our customers identify workflow inefficiencies, remove redundant manual tasks, and save time for their teams, their managers, and their patients. Learn more about how Janus's solutions can simplify your health system at janus-ai.com.
This is Beth Friedman with Finn Voices, and we are back with Todd Doze, Chief Executive Officer of Janus Health. Todd's been sharing some of the unanticipated gotchas hospitals and health systems are facing when they try to go it alone when it comes to AI and the revenue cycle. We've talked about development of the systems and long-term support and maintenance of the systems. So, Todd, are there any final hurdles with the technology in rev cycle specifically that hospitals should think about?
Yeah, I feel like we've been talking about all the red flags with AI. I should mention that, so far we've seen tremendous value be created for our hospital partners, and in my prior company as well. We leveraged, some of the early AI models, and really, I was blown away at how fast the models got up to speed and how accurate they were, and really how much time and cost they saved us on the labor side. So, while we're talking a little bit about some of the cautionary tales, I think it should be noted too that, AI is an incredibly powerful technology that will, really, really drive transformative changes within the healthcare space. But to answer your question, going back to some of the other, things to be aware of, cloud data processing and storage costs, certainly we've seen that with cloud computing, but with AI models, it's also, something that, needs to be paid attention to. Obviously, we've talked about the cost of maintenance over time and how that could, be an unanticipated line item in your budget. Obviously, engineering capacity is consideration because you have to have engineers that need to, interact with the models and train the models and integrate the models into your software platform. And, AI engineers are not cheap these days. And then just sort of, figuring out what's the value, calculating and quantifying the value of the output of the AI. So, you really want to be aware of the accuracy. And I think that's where some of the autonomous coding companies are struggling right now. They've got, maybe they're highly accurate on a very narrow, set of, you know, um, encounters that they're able to code. I talked to some folks that they do, knees and hips really well, and they're accurate, to 99% of the cases that they see for knees and hips. But, applying that technology across another specialty type might take a year or two to get fully, accurate. And so understanding that, while the model can go really fast, training the accuracy of it might take a little bit of time, and understanding that the human interaction, is still needed to make sure that the output of the model stays, within an accurate guideline that you need in order to derive value from the model is important.
Yeah, starting is one thing, but getting to near perfection is a whole nother conversation, right?
Right.
Yeah, absolutely. Um, So let's chat briefly about some specific rev cycle processes I know you guys have had some success with across your client base. One is claim status, and the other one is prior authorization. I'd love to hear some, to your point, what's it doing right? What do we see the success outcomes here?
Yeah, I think prior auth is a really good example to dive into. There's an interpretation of, clinical information that comes through when a prior auth case needs a determination. And, it can be a very manual process to make sure that, the referring provider, set the referral up correctly, to make sure that the orders, were set correctly, and then to make sure that the services rendered by the specialty provider are applied correctly in order to make sure everyone gets paid properly. And so today there's a tremendous amount of manual clinical interpretation and research that is done. But the outcomes, even though while they might be quite varied, they are discrete, and that's a perfect use case where AI can be applied to obviate the need for clinical review and research. Any type of administrative research that's done within a payer portal or an EMR system, a lot of that has sort of laborious workflows, but have, again, discrete outcomes that an AI model could really be applied to automate those administrative tasks. And that's really where Janus is focused on eliminating that administrative waste and manual work.
Yeah, and I used to work in the rev cycle at a hospital, and I certainly understand all that administrative manual work. There's so much of it still, and we are seeing a lot of great progress. So we still have ways to go. Glad that companies like yourselves are out there really tackling it.
Yeah.
So we're about to close out today's show. I'd love to hear what's ahead for AI in the revenue cycle. Kind of what gets you the most excited in your work with the industry and with your customers as far as solving, day-to-day real world problems in healthcare?
Yeah, to me, it's really about, trying to apply AI as far upstream in our rev cycle process as possible. And so eliminating errors in the patient access, part of the rev cycle, being able to share information across a number of providers so that, we're meeting requirements by the payers to, perform eligibility checks at very specific points in time. There are some payers that are getting pretty stringent on their requirements for, proving eligibility along, the patient cycle. They're saying, in some cases they have to verify eligibility within, 48 hours of, services being rendered. We've seen a lot of advancements in autonomous coding, leveraging, machine learning and AI models. And I mentioned, certain cases where they're having success rates in the high 90, percent range, which is very exciting. And so that's only going to expand. And, at some point, we'll have 100% autonomous coding, leveraging AI models. And then lastly, the reduction of denials, and the more we do to automate and make the patient intake and the coding process accurate, the less denials we'll see on the back end. But there are some, administrative billing, tasks associated with setting up a claim accurately in order to, maximize reimbursement that, could leverage AI to ensure that, there's ultimately the vision is to have a completely autonomous, automated rev cycle where, nobody has to touch a claim and the providers are being paid 100% according to the contracts they have with their payer partners.
From your mouth to the bottom line of healthcare providers, right? That's an audacious goal, but it is certainly what we're aiming for as we look at these technologies and we look at applying them in healthcare. I don't know, Todd, I think I share with you, I'm a former coder. I feel like I get to bring that up almost every podcast I do. I guess coding is relevant to a lot of things. But, I can remember as a coder, like, I would just wish somebody would just crank out those tonsillectomies and appendectomies and, all those sort of easy cases. So I could really dig into like a big open heart or a big, trauma case, because those are fun, right? So
Yeah.
I definitely see where you're going with the automated coding and hoping that can take some of those kind of rote cases off the plates of coders. So they can use their time and their knowledge more effectively.
Yeah.
So we're about ready to wrap up the show. Any final thoughts on AI and specifically AI in healthcare revenue cycle?
Yeah, no, I'm excited. And your comment about, specific healthcare cases. Actually, when I was 9 years old, I had my appendix taken out and I was in the hospital for a week. And now, that's an hour outpatient, procedure. And so we've seen really big advancements in, how we care for patients. Oncology is another area where we've seen huge advancements. And so, the vision is to see those similar types of strides to reduce administrative waste on the business side of healthcare. And it's, estimated that 30 to 40% of all the healthcare spend is attributable to administrative waste today, which is a huge opportunity for us. And so if we can reduce that, even by half, we're really moving the needle as it relates to creating efficiencies in the market. And so, I'm not a doctor, so I can't, deliver. Nobody would want me to deliver care to any patients, but I can certainly, use my experience to move the needle on the business side of things. And I continue to, get really excited about the improvements that companies like Janus are making, every day.
Absolutely. Absolutely. Likewise, as you know, I get to work with a lot of different IT companies in healthcare, and it's always inspiring. So thank you for the work you're doing, you and your team. I know that it's a big team and it continues to grow. You guys have had some big growth moments this year. We look forward to hearing back from you as the months proceed. Todd, I want to thank you for your time today. You can reach Todd on LinkedIn at Todd Doze, Doze, and learn more about Janus Health and their solutions at their website, janus-ai.com. Thank you, Todd.
Thanks, Beth.
This has been Beth Friedman, Senior Partner at Fin Partners. I thank you for listening to Fin Voices, where we talk about health information, health innovation, and all the technology in between. Until next time, wishing you all the best in health.